Hello, I'm Dee Mangan and I'm a family physician in Hamilton, and I'm also on the executive of the Greater Hamilton Health Network. Um, as you know, Omicron is spreading rapidly across our community, and the GHHN healthcare community wanted to share some important information with you about what to do if you're experiencing symptoms, how, when, and where to seek care, and valuable resources to support you during COVID. We're incredibly grateful for the hard work and dedication of our healthcare staff, but we know that in order for us all to get through Omicron, it's going to take a community approach. First, we want to share with you that the Omicron variant appears to have milder symptoms, and most people won't need to seek medical care. Individuals who are in a higher risk group should contact their usual primary care practitioner earlier in their illness, however, as they may need closer monitoring. So contact your primary care team if you are over 60, have a long-term medical condition, are pregnant, or are unvaccinated, and we together can make a plan to keep you safe during your illness. We want people more likely to be in this group to contact their primary care team early so that we can make this plan, as you may need closer monitoring, medication changes, or referral for special treatments to reduce the risk of you being admitted to hospital. Your family doctor, who knows you well, can make a plan for monitoring you at home and share with you information to keep you safe and help you care for yourself through your illness. If you think you have COVID or are recovering at home and need to speak to a primary care practitioner and don't have one, please go to this website, http://nedadoc.ca.
Hello, my name is Dr. Kathy Risden. I'm a family physician and the lead doc for the McMaster Family Health Team. I wanted to spend a few minutes giving you some information and advice about how you can make a real difference in our community's response to the Omicron variant. Within our community right now, this variant is causing a lot of infection and that it's very transmissible. It's easy to catch from one another. So if you feel sick right now, if you have symptoms that remind you of previous year's colds or flus, there's a really good chance that it's due to the COVID-19 variant called Omicron. And the good news is that it seems to be a milder variant. So the most important thing you can do when you get symptomatic is stay home and let anyone know that you've been in contact with for the previous 48 hours, the previous 2 days or so. Let them know that you have symptoms and that they should stay home and isolate too. Earlier in the pandemic, we used testing to help us understand who had COVID infection. But because so many of us right now are going to be infected with Omicron, widespread testing is no longer available. We're preserving testing capacity in Hamilton for those who have the greatest risk of illness, severe illness, hospitalization, and those who live and work in high-risk settings. So by you staying home and looking after yourself, you're helping protect that testing system for the people who are going to need it the most. Overall, the healthcare system is stressed right now. People are working extremely hard to keep things going and to look after the people who need the care most. So your contribution by looking after yourself and your family and staying home makes a huge difference to all of us. Of course, a really significant contribution you can also make is to make sure you're fully vaccinated. 2 doses of very effective COVID vaccines make a tremendous difference in keeping people out of the hospital and out of the ICUs. And if you are eligible for a booster, that 3rd vaccine gives extra protection. So choosing vaccine for your children, your family, your loved ones, and helping support your friends to make a decision to get a vaccine is an amazing way to protect the community and contribute to this unusual time where everyone needs to pull together. Thank you.